Are you concerned or frustrated about tennis elbow? If so, the contents of this short video today will hopefully be really helpful for you. My name is Johnny Smith. I'm the Clinic Director of Thorpes Physiotherapy, and over the last 24 years I've seen thousands of people with tennis elbow. I guess the first thing to say is really the name tennis elbow is not an overly helpful name, because research shows about 8% of people with tennis elbow play tennis. More commonly, it's triggered by prolonged work in the garden or DIY or things you're not used to doing, which involves gripping, especially when your elbow is straight and your palm is down. That puts a lot of tension and pressure on these tendons on the outside of your elbow, and we like to call it lateral elbow tendinopathy, probably rather than tennis elbow, but tennis and elbow is a term people know. So what do you need to know about tennis elbow? Well, first of all, you need to get an accurate diagnosis, because not all pain on the outside of the elbow is tennis elbow, despite it being the most common. So at Thorpes Physiotherapy, we're experts at assessing and diagnosing these soft tissue problems, and we'll be able to tell you straight away if it is that. Assuming it is that, the next most important thing is your understanding of what it is, why it's occurred, what could be contributing to it, and the adaptations you can make to reduce the load on these tendons. As I mentioned earlier, trying to avoid lifting with your arm straight and your palm down makes a difference. Not doing things for too long in one go makes a difference, trying to pace things a bit. So advice and education is key, but also physical treatment makes a big difference. And what that treatment consists of depends on how long you've had the problem. If we can see you sooner, which is always the best thing, then we find hands-on techniques to help soft tissue healing make a big difference. We find some forms of electrotherapy can be helpful. Acupuncture can be helpful for some people, but exercise and the specific correct exercises are really important. So we make sure we prescribe the best, most appropriate exercises. Sometimes tapes or offloading supports and straps can also be helpful for some people. Now, if you've had this problem a long time, which is something we commonly hear, people kind of think it'll get better, it's only a bit of tennis elbow, and then weeks and weeks and months drag on, and it's not uncommon for us to see this 6 to 9 months after it had started. Things tend to be a little bit more complicated then, because the body can compensate and other things can get involved. If someone's had the pain for longer than 3 months, then we find shockwave therapy can be really helpful, which we do in our Sandhurst clinic. Sometimes dry needling with acupuncture needles can be really helpful. Again, exercise is really important, and education and advice. Final thing to mention, loads of research now which indicates if you're thinking about having a steroid injection, maybe think again. Some research has shown people who've had a steroid injection 1 year later are worse off than if they'd not had anything. So I know it's tempting, you want a quick fix. Steroid can give you that relief for 4 weeks, but it's not a long-term solution, so be careful. If you want expert advice, we'd love to help you and treat you here at Thorpes Physiotherapy. Please visit our website for more information. Hope you found that helpful. Thanks.